Good morning, Lauderdale Lakes. Good morning, Broward County. I'm Hazel Rogers, Mayor of the We Care City of Lauderdale Lakes, and I'm so excited to introduce the new president of, normally I would say Florida Medical, now it's Stewart Health. And Mr. Bell, welcome to the We Care City of Lauderdale Lakes. Looking forward to hear all the awesome things that Stewart has for that location here in Broward County.
Very excited to share the next step in the next chapter for FMC, Florida Medical Center, Stewart Healthcare in this community. And I'm looking forward to contributing and doing what I can to serve the people surrounding the hospital, to provide high quality care, safe care, and access to the best care that we can provide to our people.
My first question, how are you going to change the name from Florida Medical Center?
Currently, there are no plans to change the name. Florida Medical Center has been the name of that location since its very founding by the Dower family, and has important legacy. It was the first hospital in Broward County to open heart surgeries. It's this last week, we were the first hospital to perform a minimally invasive valve procedure that required just a very small incision, about 3 centimeters, without breaking any ribs, which is important if you've ever had open heart surgery. It was very painful because they had to go through the rib cage. In this case, on Thursday, our CV surgeons were able to replace a patient's valve without causing any more harm to the patient than needed. So the recovery is going to be very fast. So Florida Medical Center has a very rich legacy of being the first of doing things in this community, taking care of our patients.
And here comes Stewart, and look at what was done under your leadership already.
It's very exciting.
Right? And exciting times for the community because, just having the hospital here, we were talking our pre-chat on transportation and getting in and out of your facilities. So I'm glad that you had an opportunity to talk to the Department of Transportation. Can you share a little bit about that?
It's very exciting, and I think every CEO, president of Florida Medical Center and government since the founding and the Turnpike went through has really seen the lack of access off the Turnpike to be a real barrier to the well-being of the city as well as the hospital. And so it was a very exciting meeting last week to sit down with the Turnpike Authority, realize that there were some very significant plans underway right now to provide that access. It's a long process of public comment and so forth, but we really believe that can be a real economic boon. It can also really provide increased access to the hospital for Lauderdale Lake City as well as the surrounding community, and I'll just continue to allow more people to come to Florida Medical Center to get that first of a time care, just like what we had this last week. And what it's causing us to do is to take a step back and say, over the next several years, how do we need to master plan the campus to really make sure that we have the capacity and the services to support the additional growth that we expect that will come with that opening of that access to the Turnpike.
We talk about science, and to me, that's another stage of healthcare.
Sure.
Okay, you invest in the research and the technology is there, and now you're able to do that open heart surgery with less invasive and speedier recovery.
That's right.
And that is the quality that we're looking for in everything we do, as we talk about even taking the vaccine in your hospital. And you were excited this morning because you were trending down and there. So let's have a little chat about the coronavirus and all of its variants.
Good. So coronavirus for us right now in the hospital, I think it's like the rest of the community. The positivity rates have come down, which means that's the number of people that get the test that actually test positive significantly. So about 3 months ago when I started there at Stewart, Florida Medical Center, our numbers were significant. We were among the highest among the 5 hospitals in Stewart. That's 4 hospitals in Dade County and the one up in Broward. That was a little bit unusual for FMC. During the surge last summer, we were FMC was not the highest census of COVID positive patients. It hit Dade significantly. This surge was I think Broward's surge because of the Delta variant and the other variants that may be out there. So, but we think the vaccines are effective. We think that people are taking some things seriously. At the same time, how do we move to having our community open? The economy moving and letting people return to some sense of normalcy. So now that the numbers are dropping, it's a very hopeful opportunity for us to take a deep breath, find our balance in this new normal. We're hoping to stabilize our workforce. It's obviously put a lot of stress among all the hospitals and keeping staff because of the opportunities they have to travel to Texas and other places for these high-end travelers. But what's really amazing, I've been there a couple of months. I ran into one of our respiratory therapists. He's our night supervisor last week, and he came here, and this was the place when he immigrated to the United States that he found a home from Jamaica. And he was talking to me a little bit about, I said, why didn't you go? Why didn't you leave? Respiratory therapists are in high demand. And he said, this is my community. This is my family. He says, I like working at Florida Medical Center because when I'm in my neighborhood, they know who I am. They come to me with questions, and I can help provide guidance and advice. And I really think that's one thing that makes Florida Medical Center really special, is that it employs so many people from the surrounding community, and they take a lot of pride in having that position, being able to be a resource to their families and community. And I really appreciated his response so much, because that speaks to a higher commitment, a higher degree of calling that he expressed. And
that is important
very
wherever
important.
you're working, because of the surrounding community and how diverse it is.
That's correct.
For Florida Medical to recognize that and make sure someone is able to translate.
Yeah.
I recall years back when they were using contractors, not really staffed personnel. Yeah. And the doctors were complaining because they couldn't communicate with the staff that they were. So things have changed in that hospital over these many years. So it's good to know that the professionals you have are permanent staff, not contractual services.
Yeah, we have our challenges with travelers, but for example, this young man, it happened to be that we had an opening, a promotion opportunity, and we said, this is the right person, the right leader, and the right opportunity. So I encouraged him to apply for the position. We're a community hospital. We are your community hospital. We do these exceptional things for the community, and we have to be part of the community. We have to be embedded in the community, and we have to draw our strength from the community that surrounds us. And so he's just one perfect example of what I think has made us unique. And that's really a great foundation for us to build FMC into the future, is that community support and that community involvement.
A hospital will not survive without the trust of the community.
That's
they
right.
have to feel like know that they're getting the best care.
That's right.
So we continue to serve on your board.
Yes.
Throughout the years, you will see members of the Lauderdale Lakes Commission serving on the board, advisory board, and our neighboring city of Lauderdale. Yes. So we are here whenever you're ready for those in-person communications with the community. We're here for Stewart Health, all right? And looking forward to introducing you to the Lauderdale Lakes community. The property you have south of your hospital. The first time I met Mr. Sanjay,
yes.
Right? We had that conversation. What are your plans for that vacant property? And it's adjacent, close to a park that we have there in the city. And we're always looking for partners for some of the infrastructure that we have that benefits the community. And we'll give you and your staff a tour of that park. It's like a nature trail.
Okay. Yeah.
See?
So I need to spend some more time, and I really think it's going to fall into that master plan. We have to look into the future, make some very good decisions about all the different property around us to make sure that we can meet the needs and have the capacity to meet the needs using our campus. And so I would say that's going to be probably part of a longer term master plan for us to put together and present to the city and get some ideas in the partnership. So that's very important. However, we use the campus can't just be for Florida Medical Center and its needs, but is also how can we strengthen the community, provide a more healthful environment for our immediate neighbors. We can't grow at the expense of our neighbors. We have to grow with and strengthen our neighborhood. So
beautiful. And I remember also, that's too much memory. You know, we were talking about that institutional knowledge that comes to play a lot of times. We were talking about, I recall at one time they were thinking of putting a nursery so that staff could have some place for their kids. That was also a conversation way back when. I won't age myself.
Right.
Okay, so.
Yeah, so, good ideas at different times, looking
Very
at
good.
the workforce, and maybe something for us to revisit, just because we're looking to find other ways besides just compensation on how to develop our clinical staff and our support staff. And now we're seeing a generational change. The older nurses are starting to retire, I think, and we appreciate their many, many years of service. But what we're seeing is an influx of new, young nurses and other clinical staff. And so where we're going to be putting our focus is on how do we do professional development, give resources. We have new educators that we're bringing in. We have relationships that we've established with FIU and University of Miami and Nova in order to provide access to these clinical advancement programs for our staff. So you're going to be seeing a lot of workforce development that Stuart brings in, one, to stabilize the workforce, but also really to elevate the clinical capability and competency of Florida Medical Center. We're a big believer in research. We're a big believer in medical education. And we think that community hospitals are the best place for people to learn how to take care of the people that are entrusted to their care.
Approach
yes.
To it. And, I'll speak to the smaller universities and colleges in our city also.
Yeah.
Consideration for some of those students to be able to get that in-person, on-campus training at your hospital.
Lots of affiliations that we're going to be entering into: respiratory therapy, surgical assists, patient care technicians, nursing. So it's not just nursing; it's the whole gamut. And I believe that hospitals, in particular, are centers of economic opportunity. They're a pathway to stable income. And one thing I believe very, very strongly as a leader of the organization is that when I hire somebody, I make a commitment to them. I make a commitment to their families that they will have a wage, that they can build wealth for their future, that they can put their kids through college, that they can plan for retirement. And so each person, I carry that commitment. How do I make sure I lead and manage resources in a way so that the people that are working with us have those abilities? And so it's a challenge, but I think it's the greatest thing that one of the biggest things we can do besides taking care of patients, take care of our people.
Loyalty will follow.
Loyalty will follow. And that's what I believe is.
Trust me on that.
Yeah.
They will love to hear that from the president, the vision that you have for that hospital and how you will treat your, not even your staffers, all of your partners that will make this venture a huge success and a continued value to our community. So I'm very much excited about you being here. We brag all the time, Florida Medical, other than our schools, is the largest employer here in the city of Lauderdale Lakes. What's that number now?
We're a little bit over 800, and we have about 400 physicians that are participating, so about 1,000 some people. If some of the things that are coming developed, then that number will continue to grow. I think that the future of Florida Medical Center is to truly become a community hospital, but with a regional reach throughout Broward County, and to bring that exceptional care. The one thing that I'm learning is that many members of our community don't know the amazing things that is available to them right there at Florida Medical Center. They may seek to leave the county, may seek to leave the community. That'll be my job. My job is to get out and communicate, share the stories, share the great experiences that people are having, how they felt safe, respected, and cared for, receiving compassionate care. But not just compassionate care, but world-class care. That's really Stuart's vision, is how do we bring that exceptional care into a community setting, because that's where most of the care is being provided. Doesn't need to be at the university. It can come right here in our community.
I'm glad you said that, because we want it right here in our community.
That's right.
Very, very good. So one of the first things you believe that you're going to take care of, Mr. Bell?
First thing I'm taking care of, well, obviously, for the first few months, it was managing through the surge that we had with COVID, and that was my first day. I walked in, and we really had, there it was, and so we really had to manage our way through that. The challenges of the traveling and some of the turnover that we experienced as people made choices for themselves to take on these different positions, and then how to keep morale up and keep us focused on the future. So now the next challenge as we move past this surge is, COVID's always going to be with us. I think it's going to be an endemic. It's going to be part of our lives.
You heard that. It's going to be here with us for a while, and it's for us to adjust
to it.
Follow the science, and take care of yourselves. Personal responsibility. And that's what we have been preaching here at City Hall.
That's good.
And when you were telling me the numbers are going down, trending down in your hospital, I'm saying that's a good sign for Lauderdale Lakes, because we have invested a lot in educating our populace.
Yeah.
We're speaking in their language, and we're on radio, and we're continuing our marketing, especially Spanish Creole, and of course, just talking to everyone, because we understand in the minority communities, sometimes, your other health conditions can make things worse.
Right.
So we're asking everyone to continue to be responsible and take care of yourselves, and you're taking care of those that are most vulnerable around you. So I'm so glad.
Yeah. So we're wearing these little pink bands.
Oh, yes, we are.
I am. Also, it's Cancer Awareness Month. And so one of the things that I'd really encourage the entire community is don't be more afraid of COVID than cancer. The lack of screening, by the time patients are getting to us now, many times they're more advanced in their cancer journey than they should have been, because their reluctance to go to their physician, to get the colonoscopies, to get the breast examinations, to get all of those screening for cancer.
Am I hearing something in my ears that I might be one of those that are too afraid to do certain things, right?
And it could be.
And we just need to, like you're saying, take care of ourselves.
Take care of yourself. Yeah. The one thing that we've learned through COVID is, we've always known life is precious, but we didn't know how fragile it was. And many of our loved ones in our community, we lost in the last year and a half to this virus that came out of nowhere. And so there's many things we can't control about life, but we can control taking care of ourselves, eating well, being healthy, working for our well-being, because our families need us. They want us to be around. They want us to be part of our community. We have a mission and a purpose. And so we have to take care of ourselves so we can take care of one another. So I really encourage people to go see their doctors, get their regular treatments, make sure their prescriptions are filled. We don't want people coming to the hospital too late. It's avoidable. Like you said, follow the science. And we know how to live with a virus.
Yes.
We've done it successfully, and we'll continue to do that. And we'll just find new ways of being more comfortable. But that's the most important message I would say today is, and that's a challenge. You asked me what my next challenge post-COVID is. We really need to communicate out there to folks to take care of themselves. Be part of the well-being of this community by seeking out those treatments and diagnostics.
Okay, and we know that you can communicate with your doctors, but sometimes you don't have to go in person to have these telecommunication tools available to us. So now you've heard it. Our new hospital, not new, the new owners are truly investing in the city of Lauderdale Lakes. They are committed to health care and quality of care in our community. So I don't believe it's a major challenge. Yeah. If you're accustomed to doing it, it's just bringing those quality services here to the city of Lauderdale Lakes and our neighboring community here in Broward County.
That's right. And I've lived here for 4 years, so I'm about 4 miles away from the campus. So just on the outskirts of Fort Lauderdale and Davie. And so this is my community. This is the neighborhood that I drive through. And just as I'm looking forward to having your participation at FMC, I'm looking forward to be actively participating in the city, in its outreach and its efforts to improve the lives of everybody around us. And because this is my community too, so I'm going to be investing in many different ways. And if anybody sees me out on the street or at an event, and you have something you want me to know about Florida Medical Center, what we can do better, how we can improve, how we can be more effective, I'm here. I give out my cell phone, my personal cell phone. I'm available 24/7 to the community, and I want to hear from you how we can be better. That's the most important thing for me.
We're looking forward to our conversation with the mayor and commissioners and our city manager and professional staff at our workshop later on today, and how we can help to make sure that things are running smoothly on our end, whatever we can do from a city's perspective to keep things moving for you, and much success Thank you
very
for
much.
joining me on the Mayor's Corner.
This has been an honor and a privilege, and thank you so much for inviting me.
All right. Thank you and good luck.
Thank you.